Hi, Cara.
Hi, Vanessa.
So, listeners, you may or may not know this about me, but I love talking about gross things. I mean, obviously, in my line of work, steeped in puberty, that might not surprise you, but like earwax and pus, although you will learn soon that medical professionals do not use that term. Smells, nothing grosses me out. I think it's all super fascinating. And our guest today, Dr. Nina Shapiro, who's a repeat guest, let me make sure I get this right, otolaryngologist, which I learned the last time we had her on, AKA an ENT, ear, nose, and throat doctor, is coming on to talk about common challenges that we deal with tweens and teens with ear, nose, and throat. And I say all of this because what she's going to do is she's going to cover super common questions. And we have a lot of fun. You'll hear it's hilarious. And those answers will live in our membership. And so when you're dealing with stuff with your kid and you're like, oh, this is so gross. How do I deal with this? Or like, oh, I can't believe this is infected. You can literally go to the membership, look it up, and all of those answers will be stored in our less awkward membership. Cara wants to use the hashtag gross.
Oh, yes, I do. Hashtag gross.
I want to use the hashtag pus, which also you will learn is spelled P-U-S, not P-U-S-S, which I always
Which Vanessa just learned is puss.
Well, I learned before.
Which is a great way to open an episode. But let's be honest, Vanessa, what you really love about this episode is we're having Nina back.
Nina's a return guest. If we were Saturday Night Live, she would get like a special jacket or something. I don't know.
You get that after 5 appearances, okay. Vanessa. What Nina would get is like, I don't know, a suction tube for the nose. She is an otolaryngologist after all. And this is an episode about things that happen to and we do to the nose, the mouth, and the ears. So this is our ENT episode, all the things that can go wrong in the E, the N, and the T. And Nina is the right person to speak about it. She's a pediatric otolaryngologist, also known as ENT. She works in LA. She was the director of pediatric otolaryngology and a professor of head and neck surgery at the David Geffen School of Medicine at UCLA for 25 years, which is sort of unbelievable. When you see Nina, she looks like she's 12. But she's written amazing books. She's written myth-busting books and evidence-driven books like Hype, A Doctor's Guide to Medical Myths, Exaggerated Claims and Bad Advice, and The Ultimate Kid's Guide to Being Super Healthy. And we love her because she gives tons of information, which you can now hear on this episode and find in our less awkward library forever and ever and ever.
Amen.
Nina, we're so excited to have you. And I just want to share with everyone the last time, well, it's not really the last time I saw you because you're my neighbor and that's one of the more fun facts about my life. But one of the last times that I didn't see you was when Vanessa and I were on book tour and I was never home. I was literally gone for weeks and weeks and weeks at a time. And of course, that's when my child ended up with the worst sinus infection of his life. And not only that, but he ends up for the YouTube viewers, they can see the chair behind Nina. She's in an exam room. He might have been in that very chair. I'm imagining. I wasn't there, but I'm imagining. And so just on a personal note, in addition to being Nina, the international, I was going to say the international man of mystery. In addition to being Nina, the internationally known and loved ENT who writes books and shows up on podcasts everywhere and is featured across media and writes unbelievable articles. In addition to that, she has taken very good care of my children. And for that, I am quite grateful. So thank you for coming back, Nina.
Thank you for having me back. And it was an honor to take care of your ill child. Maybe in this chair, maybe not.
We'll put a plaque up. So we're here to discuss all of the very sexy topics of ears, noses, and throats of tweens and teens. And there is a lot of ground to cover, Nina, in this fairly fraught and kind of disgusting series of topics. But luckily, we love getting into the yucky, pussy, smelly, pimply, clogged, bloody topics that involve this. So anyone who has like any nausea issues, we're just giving you fair
They're already
warning.
off, Vanessa. They've already pressed pause.
So we're going to go in gently. We're going to go in gently with the topic of piercing, because this is a super common battleground. This is a super common question we get from parents. I have grappled with this as styles and norms have changed about when and where kids get pierced and how often and what body parts and all of those things. In my case, it was a second piercing in my teenage kid. So let's start with the health and safety first of piercing. Like, what do we need where should they be going to get it done? What do we need to have in mind? What do we need to know? Not the part that's dependent on each household and the choices they're making, but from a medical perspective.
Okay, first of all, just one note, Vanessa. So we don't say the word pussy. I used to teach that to the residents. When they would say the wound was pussy, I would say, write it down and don't say it again.
Well, it's so funny because I was going to use that in a piece that I wrote. And then I was like, oh, that looks terrible when you write it down. I have to find another word. But so we can't even say it. Can we just not write it? Like, what's the etiquette there?
Okay. So the medical term for something that Cara has to stop laughing, it's not a very sexy word. Clearly, it's purulent, which actually could sound kind of sexy.
It's close to prurient.
Exactly.
Purulent. Okay.
Exactly.
All right.
So we'll talk about when piercings become purulent, not pussy. That's another podcast for piercing.
Also, isn't pus spelled with one S? I feel like I learned that recently, and my mind was completely blown.
Yeah, otherwise, it's puss.
Right. Thus, the reason why your medical students aren't allowed to use that word. Yes.
We're going to stay on topic. Okay. Focus.
We're going to stay on topic. Okay.
But why when we're going here already?
Okay. So the piercing issue is really interesting. So when we talk about, the basic, I want to get my ears pierced, which kids do, of any gender certainly can want to get their ears pierced. We usually talk about the earlobe, which is very different skin and safety wise than the entire rest of the ear. And the reason for that is the lobe underneath the skin is a little bit of tissue and fat. So it's a very safe place. We have a lot of room for error. If the piercing is messed up, you can take it out. The hole will close in a couple of days. If it gets infected, which oftentimes they do, even under the best of intentions, you can take that earring out, wait, usually 6 to 8 weeks and get it re-pierced. It's really no big deal. It's the rest of the ear, which is really just skin and cartilage, that is very, very susceptible to getting infected. And these infections can be quite serious and can spread and all that kind of stuff. So as far as, to your first question, where do people get their ears pierced at any age? At a reputable place that has clean instruments, good sterile technique. And, it doesn't have to be a doctor's office. It doesn't have to be that place in the mall where everyone goes because that's the place. As long as it's a reputable place that doesn't have dirty instruments and you're comfortable with it and you feel safe in that environment from a health standpoint, and there's no, C on the front, which in California usually means that they didn't pass their health inspection, it's pretty fine to get it anywhere. There are some doctor's offices who do it. A lot of kids get them here in California. It's, there are many babies who get their ears pierced in the first month or so of life. So where you get it really depends. But the same thing goes for the nose when we're talking about safety, but even more so because the nose, where most people get pierced on the outer part of their nose, is also skin and cartilage. And bonus, there are things inside of your nose, bacteria, viruses, you name it, that makes it also a big setup for an infection. The mouth, and we're going to talk about this because kids do get their tongues pierced. And I've had patients that when I say open your mouth and you can see there's a chair behind me, they go like this so the parent doesn't see, and they stick out their tongue and they've got a piercing. Bone. Usually you can tell because their speech changes a little bit when they get a tongue pierce. The tongue is also very forgiving. And we use that term in medicine, meaning that if it gets infected, as long as you see it quickly and take that piercing out quickly, it heals very quickly. The other downside, and I always tell kids, if you're going to have a surgery, you've got to take that piercing out before the surgery. It can close in an hour or two. So, if you're doing a longer surgery and you can't put the piercing back, they may have to get it redone.
Can we go back up to the nose for a second and talk about the nasal septum? So the spot between the two nostrils, increasingly popular spot to be pierced. Are there different risks there?
Definitely. So the nasal septum is the wall that separates the right side of the nose from the left side of the nose. And, people often ask, well, I think I have a deviated septum. That's a cool thing to say for various reasons, because sometimes that means you can also get some cosmetic surgery if you have a deviated septum. That said, nobody's septum is perfectly straight after the age of about 8. Everyone has little curves to the septum. But the concern for piercing is not that your piercing is going to be off to the right or the left. It's that the septum is cartilage, and it's very, very delicate cartilage. And if you pierce that, and let's say it gets infected, or you change your mind at some point and want to have that piercing out, that's a place you don't want to leave a hole. A septal perforation, which is a permanent hole in the nasal septum, can lead to all sorts of problems, crusting and bleeding, and it can cause some loss of integrity to the structure of your nose. So those septal piercings, which are trendy, need to be done by someone who really knows the nasal anatomy and really knows where in the septum it's safe, and to do everything that you can to not get it infected. Because again, you can't sterilize the inside of the nose. You can put all the alcohol and peroxide and all the cleaning stuff you want. There's bacteria that loves to live there, and that's what they're there for. So the risk of infection is very high. And then the permanent damage is real in the nasal septum.
So I realized I forgot the term crusty in my description of the things that we were going to cover. So Nina, thank you for doing that. Speaking of crusty, let's talk about stuff inside the ears, earwax. As kids get oilier, thicker sweat, they may have pimples in the ear, on the back of the ear, crust. Let's talk about hygiene and some things that we can share with kids, and also what adults shouldn't be doing, myself included, when they see interesting things happening in their kids' ear.
Okay, but let's start with wax. Wax is such a good topic that we never talk about, which is sometimes crusty, but not always. Do you want to get into wax a little bit, Nina, and how to clean it and when you should and why?
I get into wax all the time. I can always talk about earwax. So earwax, first of all, is normal. Someone comes in and saying, I have earwax. That's normal. Wax
You're like, yes, you do.
Don't we all? And earwax is there for a reason. It's antibacterial. It protects the very delicate lining of the ear canal. And that's about it. And it's usually self-cleaning, meaning that you don't have to remove it. It just kind of comes out on its own. You don't usually see it. It's little flakes. Different skin consistencies have different consistencies of earwax. So there's flaky wax, there's crusty wax, there's mushy wax, there's impacted wax. And there's no right or wrong kind of wax. It just depends on your skin quality. If it's oily, if it's thicker skin, it tends to have different consistency of earwax. Usually I recommend leaving it alone. All that Q-tips do, or we call them cotton tip applicators because Q-tips is a brand, which I am not promoting. It pushes the earwax in. It takes a little bit out, and you can see it on that Q-tip and say, yes, I'm doing it correctly. But most of the wax that you are sort of manipulating with a Q-tip gets pushed in and impacted onto the eardrum. And the other thing just to know is the ear canal is not a straight cylinder. It has a little curve to it. You can never get around that curve because that's actually bone. So leave your wax alone. That said, if you feel like the earwax is bothering you, or if it's blocking your hearing, or you can see it and it does sometimes have a little bit of an odor to it. I know we love talking about smells. Then go see your doctor. And, oftentimes the primary care doctor can remove it, or if not, they can send them to me and here's the chair. We'll take that.
There's little that was more satisfying when I was a primary care doc than taking out earwax. I know it sounds so disgusting, but it's like, if once you figure out how to do it, it is the most satisfying thing. And then the kid on the other end, if it's truly impacted, often they have trouble hearing and they can hear. Now, they can't hear when you say, go make your bed or clean up your room, but they can hear everything else, which is incredible.
And one of the culprits of earwax in teens and tweens is earbuds, because it pushes it in. And then they make their earbuds louder, and then they can't hear, and then they're getting more wax because it's just kind of pushing it inside their ears all the time, which is one of the reasons why they turn up their volume so loud.
So let's talk a little bit about, before we get to furuncles, which we are going to get to furuncles. For those of you wondering what that is,
furuncle, but you can just call it a furuncle.
It's cool. A what?
It's a furuncle. It's the emphasis is on the fur, not on your uncle.
Not a furuncle. Before we get to a furuncle, Nina, can you talk a little bit about how we talk to our kids about AirPods, earbuds, hygiene, use, all of that in a way that they will actually listen to us and not just roll their eyes? What is some scientific information we can give them to make it more convincing?
So the real science, which, kids of many ages and adults included don't really care when you say it can be permanent, but the science is that long-term noise exposure, and noise is primarily AirPods, earphones, loud music of any kind, that is a nerve loss, what we call sensory neural hearing loss, irreversible. So sometimes that resonates with tweens and teens. Sometimes it doesn't, because that still seems to be down the line. That's not me. That's that old person over there. But we see teens with hearing loss related to AirPods, even, before they finish high school. Mm-hmm. So that's something to know. What can work is, and this is sort of fighting fire with fire, there are these great apps that can monitor your daily noise exposure. It measures the time that you're on, it measures the decibel, and it measures the distance that you're exposed to. And so they can track their activities and track all of their other data. They can track their noise exposure. And that sometimes gives them some incentive to minimize it.
Are over-the-ear headphones better than earbuds, or is there not a difference in terms of exposure?
She asks while wearing over-the-ear.
I mean, we spend hours with these goddamn headphones on. So yes, I'm asking for a friend, Nina.
Yes, for various reasons. And actually, over-the-ear noise canceling are the best, because that implies that you're not having to up the volume to cancel out the background noise. So over the ear is better. And it also is not irritating your ear canal like the in the ear earphones. So definitely better.
But I'm going to go safety here and just say wearing noise canceling headphones or earbuds or over the ear while walking down a street is an absolute safety risk, because while you don't have to increase your volume in order to hear what's playing, you also cannot hear the cars coming down the street or pulling out of driveways, or the bicyclist who's behind you saying, on your left, on your left. And I semi-joke, but really I don't joke. When my own kids are listening while doing anything, the rule I always raised them with was listen in one ear. But really, you shouldn't be wearing what we're wearing, Vanessa. This is for professional podcasters only.
We're so professional.
So one ear, bud, definitely. If you're running or walking or out on the street, you can alternate ears. That also is a little safety thing. And now they make those, they're very attractive. Those bone headphones, which actually have amazing sound quality, and they don't go anywhere near your ear. They go on the bone right behind your ear. You can listen to anything, including this podcast, and then your ears are fully exposed to the world. So that's another great sexy option.
I was just going to say, just to make us even sexier, we will invest in those. Nina, before we move on to the throat and the mouth, can we talk about the furuncles? Plural?
It's not two words. It's one word. It's just emphasis on it.
I'm just,
Furuncle.
last time we met with Nina, I learned the word otolaryngology, and
She
today
flexes it every day.
I use it in every episode, Nina, whether it's relevant or not. And today I am learning furuncle. Furuncle?
Furuncle. Furuncle.
Furuncle.
Furuncle. It's and it's
okay.
It's as weird as it sounds, and it's purulent. Usually,
she's always bringing it back to pus. All right, tell us about it. I'm not going to try to pronounce the word because Cara's just going to laugh at me. Tell us about the F word.
The F word. It's an ear pimple. It's an ear pimple.
Inside the ear, outside the ear.
So usually you can't see it, but it is exquisitely painful. And so it sometimes feels like there's something stuck in your ear, or it feels like you have like a big pile of wax in there. And it feels like you see kids and they kind of try to push it, almost like they're trying to pop a pimple in there. And again, the ear canal is so delicate, and it's literally skin and cartilage or skin and bone. So if you're digging around in there with a Q-tip, or kids will get get their hands on a little needle or something and try to pop it. It's a really, really bad setup for a bad infection. So when we see furuncles, we try not to touch them. It's really tempting to just pop those babies, just like it is to pop a pimple, but it can spread. So sometimes topical antibiotics, more often oral antibiotics, because it is a skin infection, and just putting some antibiotic cream on an infection that's under the skin is not going to do anything, right? So oftentimes oral antibiotics, sometimes some ear drops, and oftentimes they just open up on their own, just like pimples. And very, very rarely we'll need to go in very clean the area, and it's because it is, sort of contaminated skin, and pop that baby. But don't try that at home.
Are there videos on TikTok of
Dr.
people?
Pimple Popper?
Yeah. Of people popping furuncles?
I'm sure there are. Why wouldn't there?
Okay.
I mean,
millions of views. Yeah.
While we're on to painful things in the ear, it's, swimming season. And swimmer's ear is largely misunderstood by people. I mean, except for people who have had swimmer's ear and then look it up and they go, oh, that's what that is. Because sometimes they think it's an ear infection, and it's an infection of the canal, but not an infection behind the eardrum. And there's a magical cure for swimmer's ear, a preventive, actually, that people can use. Do you want to talk about that for a sec?
So sure. So swimmer's ear is really common, and in Southern California, sorry, Vanessa, we see it all year round. You probably see it from the indoor pools because there's a lot of chlorine there.
I would get in the summers at camp, they would give us alcohol drops when we got out of the lake every time. And my memory of the waterfront at camp was the smell of the alcohol drops.
You went to a very good camp.
I went to it. It was founded by 2 educators. So that tells you they were no stone left unturned. Is that still the proper practice, Nina? Okay.
Yes. And the reason for that is the reason you get swimmer's ear is there's a little water and humidity, and it doesn't even have to be from swimming. It can just be from hot weather, and you're sweaty and it's humid, and inside your ear, it's a nice little greenhouse, and little bugs grow in that nice little greenhouse. So isn't that great? I love your face, Vanessa, when I say that.
This is my jam. If I didn't have to go to medical school, I totally would have been an ENT doctor.
So much fun. So what the alcohol is drying. And so that dries out that little residual, whether it's lake water, pool water, your own sweaty water, it just cleans it out, dries it out, and doesn't give the bacteria. And it's also, sterilizing a little bit, but mainly that it dries it and doesn't give the bacteria that nice environment. Bonus, you can add some white vinegar, especially if you're going to be in or have been in a hot tub, because that's where the fungi live.
Are the fungi friends with the furuncle?
They are besties. Absolutely.
Before we move on to other parts of the body, a kid who says to you, "Oh, I have water stuck in my ear. I can't get it out." What do you do besides the white vinegar and alcohol drops?
So a couple things. If you are at home or going to be home, a hair dryer on a very light, low setting, about a foot away. So don't put the hair dryer in your ear, but about a foot away. If you hold that dryer, that does kind of help dry it out. You can very carefully roll up a little tissue and put it on the very, very, very outer part of your ear and kind of wick it out, and that will attract the water to come out. If they're really feeling like there's something there, it may indeed actually be an ear infection behind their eardrum, because usually a little water in the ear after swimming isn't that uncomfortable. So it may be that maybe they have a lot of wax and the water got trapped behind the wax, and that's really, really annoying. Or they have a regular old middle ear infection, which is what we talk about primarily for young kids, but older kids and adults can get that too.
Okay, we're moving to the mouth and the throat. We talked about piercing. I want to talk about another age shift, which is when kids are little, their breath smells like milk and honey, and you just like want to lie next to them and breathe in the magical unicorn scent of kids' breath. And then there's a point where they wake up one morning and they have dragon breath. And you're like, oh, where did my delicious child go? What happens, Nina? Why does it shift like that?
There's so many reasons for that, but I'll relate them to my work. Obviously dental hygiene. I mean, that's a basic thing that, it's not just brushing your teeth once a day. You need to brush your teeth before you go to sleep. You need to floss. Oral rinses, plus minus. I mean, they're sort of mixed on that one. They have some anti-cavity rinses, but, it's mainly just brushing your teeth, not eating close to bedtime. So no milk and cookies, honey. Really just, water with it, the last hour or two before bedtime. Because if you have a little bedtime snack, you're going to have, even if you don't have any symptoms of reflux, babies get reflux, kids get reflux, teens get reflux, that causes horrible breath. So no eating close to bedtime. And
it was as fun to grow up in your house for your children as it was to grow up in my house for mine. I'm just interjecting. Keep going, Nina.
Kitchen's closed. Sorry, folks. So it could be what they're eating close to bedtime, and obviously as they get older and older, they're eating later, they're having snacks, they're famished all the time. So trying to avoid that. And it could be sinus nasal stuff, post-nasal drip. Nasal stuff drips into the back of the throat. It's a horrible smell. Things that you need to sort of look out for if your child is snoring, if their mouth is open all night, that's going to give horrible breath. And one very, very specific reason where, do not wait. If your child's breath smells so bad that you have to say, here, take my child, I don't want to go near them. They smell and one side of their nose is draining green stuff. And this is any age, not just little kids. They have stuck something up their nose.
Mm-hmm.
And, I have seen beans sprout in the nose, and you name it down the list of things in the nose that causes the worst smell ever.
So, Nina, if my mother was here with us, which trust me, she would love to be here with us having this conversation, she would tell the story of when I was little and she noticed that my nose was running. And then she noticed that I started to smell, like my nose was smelling. And she took me to the doctor and they pulled out, I had shoved up some gauze or something up my nose, and it was essentially like rotting in my nose, and they pulled it out. That preceded the time that I swallowed a penny. Yes, there was that, because it tasted like, I was like, oh, it tastes like blood. That's so interesting. Why does a penny taste like blood? Obviously the iron. And then I swallowed it. So I was a very interesting child.
Two more reasons why you wish you were an ENT. Can we stay on tonsils a little bit and adenoids, and let's go to snorers and snoring. And I have so many questions, starting with, at what age, what's the youngest snorer you've ever heard?
Oh, newborns. Newborns. Yes, absolutely. So newborns are obligate nasal breathers, meaning they don't have the reflex. Like your nose is stuffy. What do? You open your mouth and you can breathe. They don't figure that out till they're about 5 months old. Their brain is not. Isn't that crazy? So
ironically, Vanessa's mouth just went wide open.
Right. So newborns who have any sort of nasal congestion for various reasons, they can snore. They can also have floppy tissue in their very upper airway. The top of their trachea is actually at the back of their tongue when they're born. It's crazy. You can actually, if you put pressure on a baby's tongue, you can see the top of their windpipe. And so that if that's a little bit floppy, that they can snore. Typically, the snorers that we're thinking about, if we're thinking about adenoids, tonsils, stuffy noses, the most common age range is 2 to 6 or 8. 2-year-olds to 6 or 8-year-olds. But we see snore, obviously adults snore for many reasons, teenagers snore, but the tonsil adenoid age primarily is like late toddler, early elementary school.
So is that why we have to like torture infants with those little suckers that take the mucus out of the boogers out of their nose?
Because they love it.
I mean,
I'm not joking. They actually love it.
My kids screamed bloody murder, and I swear I scarred my children. And here's a fascinating thing. The cutting the infant fingernail, and you're so terrified, and then you accidentally cut a little bit more. That was this thing that I hated almost as much as sucking the boogers out of my kid's nose. I just gave up on doing it. But now I know why it's so important, because they don't mouth breathe.
Yeah. And also I know this sounds so odd, but a lot of people will bite their kids' fingernails. I started doing that. Not voting or not voting.
No, I started doing that because I couldn't. Yeah. I was so.
It's very hard to bite the skin off. Yeah.
Yeah. I
still do it. Nina goes to her daughter's college and she's like, it's time for a nail trim.
Flies across the country. Okay. So I want to move into some older kids stuff about mouths and throats. 2 topics I want to make sure we hit. One is vaping, smoking, and zins, and like what can we say to kids who are at the age where they may be exposed, and how do we share with them the concerns and hazards of doing those things? And then we're going to move into HPV. But can we talk about nicotine products and the impacts on throats and mouths?
Sure. I mean, obviously vaping, smoked, any cigarette smoking, marijuana smoking. Zyn is, for people, I think everyone knows what a Zyn is now, those little nicotine pouches that kids, it used to be tobacco that people would chew or take a little dip, I think it was called. And Zyn is kind of the new version of that, can cause dangers at any age. And primarily, we don't know what they're inhaling. I think vaping had that early idea that this was somehow safe and safer. And certainly there was some good evidence that it helped people who were existing tobacco cigarette smokers, help get them off of tobacco cigarettes. But what it became was really just a gateway to cigarette smoking. And that's been well studied in many large populations of teens. It's a lead-in to cigarette smoking, tobacco cigarette smoking. And it's really harmful to the lungs. It's really harmful to the throat. The chemicals in a vape pen are, I hate to use the word toxics. I think that's a lot of nonsense usually, but they are truly toxins, and it can cause some serious damage. And a lot of we've heard about these vape pens that explode, that cause other sorts of brain side effects. So certainly no joke for any of those. The nicotine is extraordinarily addictive, and really one thing leads to another when you're talking about any sort of addictive substance that's in your child.
I mean, one of the most vivid memories I have of traveling to Europe was going through the airport, and you see in the duty-free shop that you're sort of shepherded through between security and your gate, that all of the packets of cigarettes have very large pictures visually showing what some of the physical risks are of tobacco smoking. And many of them are lesions around the mouth, or, it'll show someone who has a trach, which is an airway that bypasses their need to breathe through their mouth because they can't anymore because of all the cancers in their mouth, and they just suck air in directly into their trachea. There are these incredible visual images. We don't have those for vaping devices or for ZYNs because these products are too new to understand what the long-term impacts are. This is not me saying I know for sure. I'm just using common sense here and saying that when you take, for instance, a heating device and you vaporize a substance that has lots and lots and lots of chemicals in it, common sense would suggest that in 20 or 30 or 40 years, we are going to see pictures on boxes of vapes that show all of the oral cancers and oral problems that happen. Is that fair, Nina? A fair guess?
Hopefully less than 20 or 30 years. Yeah, but yes, definitely. Especially, because I think people are starting younger than cigarette smoking was typically, I think, it was around at least, when I was in high school, it was kind of like the 9th, 10th graders, but vaping is, late elementary, early middle school. So, you'll probably start to see the problems sooner unfortunately, in those kids.
Yeah, just a PSA, like just the best you can, keep these things out of the mouth. Now, there's a reason why a lot of these substances are either inhaled or put in the mouth and absorbed directly through the mucosa of the mouth. Nina, you want to talk briefly about how fast that absorption happens?
Right. Oral absorption is really, really quick, which is great for so many of the drugs that we use. Think about back in the day, although it's still used, people would say, I need my nitro when I have chest pain. And that was nitroglycerin that you put under the tongue, and it opens up the vessels in your heart in seconds. And it's incredible. And there's so many drugs now that are given orally because they're absorbed so quickly into the whole bloodstream, not just into the lining of your mouth. In seconds. And so it's the same thing with smoking and ZYN. It's obviously a topical exposure. And we don't know what's going to happen. But for instance, people who chewed tobacco would get cancers where they chewed tobacco. They wouldn't necessarily get lung cancer. They get cancer in the lip, in the mouth, in the tongue, in the cheek, because that's where the carcinogens are sitting directly. And so for vaping, it's this direct toxin exposure into the mouth that, will probably cause some problems sooner rather than later.
So these are the conversations. We got to get really specific with kids and maybe even get some visual aids so they have a sense, because it's impossible for them to imagine or think about the long-term effects. And we've got to really get concrete with kids about why this stuff is so concerning. Let's shift to another mouth-related topic and other places related topic, which is HPV, and also if we have a minute to talk about herpes as well. So HPV, do you want to talk about how that can manifest in and around the throat and mouth, and how that happens, and how the vaccination may help or impact that reality, Nina?
So HPV is a virus. It's the human papilloma virus, and it is preventable. Simple as that. It is a now preventable disease. And the goal is that in hopefully a generation or so, it will be a historic disease. I don't know if that's necessarily going to happen. There is a great vaccine that's been evolving over the last several decades as far as how many you need to get, how many strains of the virus it covers. But the long and the short of it is a preventable disease. It's a virus. It's very contagious. It can be transmitted sexually, oral, and it is usually visible as what we would typically call warts. So you can get genital warts, you can get anal warts, you can get oral warts, you can get warts on your vocal cords, which is a problem that we see in very young children, and those develop from maternal transmission, not vaginal delivery necessarily, but transplacental probably. It's a virus that can affect the vocal cords to the point where children need surgery every 2 weeks. It's a devastating disease of childhood. Thankfully, it's very rare. So these are warts, which seem like a pain, seems like a drag. The concern about these warts is that they can become cancerous. And there's something that we as ear, nose, and throat doctors call the baby boomer cancers. And we're seeing it in people much younger than baby boomers. And these are cancers that started as these seemingly unexciting warts that can become cancerous in the throat, in the mouth, in the genital region. And again, just to emphasize, this is preventable with a vaccine.
And let's talk about herpes for a second, which is also a virus, but has totally different presentation, and the way it's managed medically is totally different.
So herpes is a virus, and most people have herpes in their system because it can be latent, which means not like a late bloomer, but like it just kind of hides away for years and years at a time. And then every so often it can kind of rear its ugly head. And the other thing to emphasize is there's several different types of herpes. I have herpes. There's genital herpes and there's non-genital herpes. There's herpes 1, herpes 2. These are different types of herpes viruses. Typically, if you think of somebody who has a cold sore, that's often a herpes virus. And they're very contagious typically, but some of them are just in your own body and they just come out at certain times. Typically, people say it's a cold sore because it comes out during stress or during an illness or during an emotional stressful experience. It'll come out. There are treatments now to nip it in the bud, so to speak. And a lot of people who tend to get these cold sores get this tingling sensation well before the actual cold sore comes out. And if they take their medication, it can prevent an outbreak, which is great. It's very contagious. It is sexually transmitted. So there are ways to prevent that transmission just as with anything else.
And Nina, we were taught when we were younger that you just, if someone had a cold sore, you didn't kiss that person because that's how it gets transmitted. But we have since learned that that is not entirely the case, and there's other ways to transmit it. Can you explain a little bit about that?
That's what we call herpes 1, which is the cold sore herpes virus, which tends to be, again, it's more internal to you and it's hiding in your nerves and then it comes out, but it's not necessarily transmitted to another person. The STI herpes that we think of, that is also contagious. That is the one that's contagious when you have an outbreak. So if you have genital herpes and there are lesions there, then it is directly contagious.
And just to put a really fine point on it, about 2/3 of the world's population has antibodies to herpes, meaning they have an infection with a herpes virus, one that is most likely dormant in their body because you almost never clear the virus. You almost always live with the virus, as Nina described. And remember that genital herpes can become orally manifested when people have oral sex. So if someone has a genital herpes wound, lesion, and someone else has oral sex with them, you don't even need the lesion actually to pass the virus. Then sometimes the first way that their herpes infect, that new person's herpes infection will come out is around the mouth. And what we typically see is not one sore, but the first time you get a herpes outbreak, it's kind of a big cluster of cold sores in one spot. And that can be sort of what we call primary herpes, but it looks different in everyone. And I think when we were growing up was highly stigmatized. Happily, it's not highly stigmatized anymore in the same way because so many people have it, but this doesn't mean it's benign. It can cause all sorts of big problems over time. And so I would anticipate, Nina, I don't know what you're thinking, but I would anticipate that there are a lot of people working on a vaccine and this will be vaccine preventable at some point in the next decade or two. That's really my hope.
And it's kind of similar to chickenpox, if you think of it that way, and they can look like chickenpox lesions. So there's a chickenpox vaccine for those of you youngsters out there that are too young to have had chickenpox. There is a chickenpox vaccine. And again, the herpes virus is similar to the chickenpox virus. So I agree, Cara, it's probably going to be vaccine preventable. And to differentiate, well, how do you know if it's herpes or HPV? HPV typically is not painful at all. It can look a little funny, like a wart, like a little, we call it cauliflower look. Everything is food related in medicine when we can. And so we call them cauliflowers. And herpes are quite painful. I think that's one. And they look kind of like like a raw, open, like picked at mosquito bite, as opposed to just this kind of fleshy looking tiny piece of cauliflower.
I love how visual you are, Nina. It's really bringing it all to life. Speaking of, let's move to the nose and things brought to life or out in the open. Should we say that? Hopefully your tweens and teens are not picking their noses and eating it, but that's a hope. Nina, what are you seeing in tweens and teens in terms of maybe they're shoving stuff up their nose, but maybe they're not eating it? But what are the impacts? What are the effects of this behavior that we hope they will grow out of? Things like bloody noses, things like that. What do parents, what should we be out on the lookout for, and how do we get them to stop? Hopefully.
I think a lot of teens pick their nose a little bit.
I mean, a lot of adults pick their nose. I'm not saying it's just them.
And frankly, if they eat it, it's pretty harmless, assuming it's, yeah.
Wait, are you serious? I always thought it was like you're eating like bacteria and all the stuff your nose was like cleaning out.
Yeah, but it goes to your esophagus and your stomach, and it's not going to hurt anything.
So should I just be like, go for it, eat it? I don't care.
It's disgusting, but it's a disgusting habit, but it's not a harmful.
It's not a nutritious snack.
No, it's not going to fill them up.
I can't believe that. I've been
It's
telling
the
my
second
kids.
jaw-dropping moment of
I've
the
been telling my
podcast for
kids
Vanessa.
for 20 years, don't eat your boogers. It's filled with all the stuff your body is trying to keep out.
You know what? It's all you need to say is don't pick your nose because it's gross. Then stop there.
Oh, trust me. Well, my mom is featuring heavily in this episode because she also says you can pick your nose and you can pick your friends, but you can't pick your friend's nose. That she uttered only days ago, Nina. It must be an anticipation. Okay. So they can eat it. It's gross, but it's not harmful. Fine.
Right.
Bloody noses.
Right. So bloody noses can be from picking, but teens tend to get bloody noses just because they have a lot of big, juicy blood vessels all over their body as they're growing. Some of it's hormonal, some of it's just growth. And the blood vessels in the nose are like little tiny spider webs, and they come to the surface, usually at the front part of the nose, at that septum. And then literally anything like the wind or dust or a little light touch can open up those blood vessels, and they bleed like crazy, and then it seals off. But the blood vessel lining is so delicate that it just keeps happening over and over and over again. So I see a lot of kids, teenagers, who've had lots of bloody noses, usually in the front part. We can take care of that in the office. We can do a very, very quick procedure called nasal cautery, and that's part of it. But then we also have to talk to them about prevention and treatment. How do you prevent bloody noses if you tend to get them? And how do you treat them when you get them? And I usually tell them, I'm going to cauterize it, but you still may get some bloody noses. So here's what you can do. So prevention, really any sort of ointment. I like to use a water-based ointment as opposed to petroleum-based ointment, just a little safer in the nose. Towards the center, and this is where they can put their finger in, just towards the center, just a little past the tip, every night before bedtime. Bonus if they can do it in the morning before school. Sometimes nasal saline can help, although some people say, well, the saline dries it out. Mm-hmm. But just the ointment is really the key thing. I always check the fingernails of kids of all ages. If they have long fingernails and if they have like black lines on their fingernail, they're picking their nose. So I go over that with the parent about minimizing nose picking. If they're really dry, then a humidifier at night may help as well. Treatment tends to be, I say, what do you do when you get a bloody nose? I don't know. Depends on the kid. So this does nothing. This
Nina
is not
pinching her nose and just
pinching my nose at the bridge of my nose where the bone is, does nothing. It's coming from the front. So you want to close your nose, pitch your nose closed like you'd have a clothespin, because that's where the bleeding is. That's the direct bleeding point. You don't want to lean back. You don't want to lean forward. You want to stay straight up like this. Leaning forward increases the pressure. It's just going to bleed more. Leaning back just means you're going to swallow the blood, and it's gross. And why do that? The other thing that can help during a bloody nose is the vessels are coming from the roof of the mouth. So you want to freeze those vessels. So get some ice water, drink some ice water if you have, eat something cold, drink some cold water. that's a little bonus to kind of freeze those vessels if it's bleeding and you're home and you're near your freezer.
I'm going to throw out 2 others. The frozen key trick, right? So you take a key, throw it in the freezer for a couple of minutes, then take it out and put it on between the upper lip and the nose. That also will make those blood vessels constrict down. And the other one is, some people like a humidifier in a dry room, but I personally, Nina, I put a big asterisk by that, because sometimes humidifiers, when they're not cleaned regularly, can have their own issues. They can spread mold spores and other things like that. They can grow nice gunky bacteria in their own. And I will add just a little empathic plea to the parents of nose pickers. Sometimes it's just purely habitual. They don't want to be picking their nose, but they're pickers, right? And so for those kids, keeping their hands busy helps, right? So if you've got silly putty or a stress ball in your hand, it's really hard to also pick your nose.
Nina, you are a wealth of information. You never fail to blow my mind. Thank you for coming on and just completely illuminating the ear, nose, and throat and teaching me new words every time I see you. Come back and visit us.
Thank you so much for having me. It was so much fun.
Thank you so much for listening. You can email us with questions, feedback, or episode requests at podcast@lessawkward.com.
If you want to learn more about what we do to make this whole stage of life less awkward for everyone involved, our parent membership, our school health ed curriculum, our keynote talks, and more are all at lessawkward.com.
And if you want products that make puberty so much more comfortable, visit myumla.com.